Um, Hello, I am Dr. Sumaya. I'm here I'm cardiologist. I'm here to see your complaint. Can I confirm your name?
Yes, I'm Nur Sharif.
How old are you, Noor?
I'm 55.
Okay, Noor. Are you married and have children?
Yes, I'm married and I have 5 children.
Okay. What about your menstrual cycle?
It stopped since 1 year, I think.
Did you smoke before?
No, never.
What about cat showing?
Yes, I'm cat showing.
Um, um, okay. Can you describe for me your chest pain?
Yes, so I'm having chest pain just like here since 3 hours, and it's going to my two arms. It's really harming. I'm feeling that my heart will stop. It's burning. That's it.
Um, can you describe it into what's the severity from 1 to 10?
It's 10 to 10. I'm feeling that I'm having a big stone here on my chest.
It goes to another side from your body that's just being radiated to any side.
To my arms, just to my arm.
Uh, okay. Is there any nausea? Did you
Yes.
vomit in your home
Yeah,
before
yeah.
come to
Yeah.
ER?
I'm having nausea, vomiting,
Mm,
and sweating.
yeah, you're sweating. There is no insult of palpitation. You feel like your heart is running.
No, no, I'm feeling that like it's burning, but I don't think that I have some palpitation or something like that.
Okay, what about shortness of breath? Did you feel any shortness of breath?
No, no,
Okay. There is no history of coughing, no
no,
history. There is a history of coughing, um, fever,
no, no,
abdominal pain. No. Did you feel any pain anywhere in your body?
no. I think that I have some numbness in my lower limbs.
And otherwise, everything is normal with you.
Yes.
Did have no any complaint except that chest pain?
And my lower limbs. Like
Mm.
I think that I'm having some numbness, something like that in my lower limbs.
Did you have any chronic illness like diabetes,
Oh,
hypertension?
yes, I forgot. I have diabetes and I have it since like 5 years, something like that.
Did you take medication?
I have medication, but I don't take it regularly.
Uh, Sorry for that. What about hypertension? Did you have hypertension?
No,
Did- Another chronic illness?
no.
No. Regarding your family, any one of them has any chronic illness?
I think that my dad told us that he have like some heart attack. I think that he had a heart disease, but I'm not sure what it was.
Uh, okay. Did you take any medication in home before reaching? Do you come to the ER?
No, no.
No. Okay, now I want to just to take to examine you and take blood sample for some investigations and do ECG to confirm our diagnosis and inform you after that. It's okay for you?
Yes, yes. Okay.
Okay,
Thank you.
welcome. Hello, Noor, how are you?
Thank you. Hello.
What about chest pain now after you took that medication in ER?
Alhamdulillah, it's really better.
Alhamdulillah. Now, I'm sorry to say that unfortunately you have you or your ECG, your symptoms, and your blood samples, all of them show that you have myocardial infarction.
Oh no, like my father.
Um, I guess that now
Oh my God.
that
Okay.
everything will be okay, inshallah. Just I want to inform you that I will send you to coronary cardiac care unit, and we will follow you for 1 to 2 days or 3 days under observation. And if you agree, we will just do a more invasive investigation like a coronary angiography. Did you hear about coronary angiography?
Yes.
Do you understand what is it?
No, I just know the name.
Okay, I will explain for you. It is uh, just the investigation to do it to for all patients has a myocardial infarction to just take a picture to the coronary vessels via injection of contrast through a femoral artery and to take just the image and just there is a local anesthesia and you saw what will we will see together the results of the coronary angiography. If
You'll open
after that
myself?
no. It is just a needle. We inject through it and through the femoral artery contrast uh,
What's
to
femoral?
reach coronaries of your heart. What?
What's femoral?
What?
I don't understand. What is femoral? It's from where?
I'm sorry. It is a vessel or artery that in the femoral what can I say in the upper part of your thigh and through that artery or vessel we can inject just contrast to take image your for your vessel that supply your heart by oxygen and nutrients.
Okay.
Okay. After that, according to the results, if there is any lesion in the your artery that supply the heart, we will start it to what can say to see the percentage of the occlusion of that vessel. If it is less than 50%, we will take just medication and just follow and control your risk factors. And if there is more than, we will put stent.
Okay.
The stent, you
What's
know what is the stent?
No.
It is a material or substance. We open the artery by it.
Okay.
Okay, in the same sitting. If it's okay for you, we will progress to this investigation.
Okay. I'm okay.
It's okay for you.
Yes.
Okay, we will do it inshallah after tomorrow.
Okay. Okay, inshallah.
Oh, inshallah. Hello Noor, how are you now?
Hello. Fine, thank you. I'm feeling good right now.
Alhamdulillah. You know that we put stent in your vessel that supply your heart, and we explained that during session that yesterday. Okay. Now I want you to continue on some medications. I will inform and explain everything. Did you want to ask me any question?
Yes. For how long do you think I'm going to take this medication?
You know that medication you must adhere it to for life because you bought stent and you must take it regularly and follow our clinic to follow you and increase the doses to protect your stent and to live without any chest pain. Okay.
Okay. Okay.
I want to inform you about one drug. It's called clopidogrel. I prefer to take it carefully with your other medication to prevent any thrombosis in the stent or in the future stenosis. Okay.
Okay. And they will take it lifelong?
I think you can after 1 year to stop it, but if you can continue, it's no problem.
Okay. And how about going to my village? Can I go next week?
If the route of the traveling it's okay, and if there is a medical center or cardiological centers in your village, you can go. But I prefer to stay here in the capital, near to our hospital, to follow yourself before go anywhere.
Okay. And how about food or drinks? Do I have to avoid some foods or some habits? Can I continue cat showing? What do you think?
I prefer to stop cat showing as you can, and because it contains some substances increase your blood pressure and increases the heart rate, and that it is against your situation. And regarding your food, you know that you have a diabetes. I want to control you to adhere to diet and your medication carefully to control your diabetes. And I hope that to avoid the lipid-rich food. Okay?
Okay. Okay.
It's okay for you?
It's okay for me, but I'm really afraid of having another heart attack. So, do you have some habits to tell me?
You know,
Yes.
Amona, sorry, no, I want you to change your lifestyle, because when you change your lifestyle and adhere to walk, for example, for half an hour twice weekly, control your diabetes, adhere to your medication, we can, inshallah, prevent another attack. But if you neglect some of these, we cannot. So take care about that.
Okay. And when will be my first visit with you?
I prefer to follow us after 1 month to increase the doses of your medication. And to check your blood sugar and the blood pressure, and do ECG with echo to check everything before you travel to your village.
Yeah. Yes, but I did echo in this hospitalization. Did
It's
did
okay.
it show something abnormal or
There is some what we can say there is something in motion abnormality of your myocardium, and we want to see after that we open that vessel that supply your cardiac muscle, and to check after 1 month to see if the you get a benefit from your stent or not.
Okay. Okay. Thank you very much, doctor.
I hope that you understand everything I explained.
Yes, thank you very much. I'm really grateful.
No problem. Inshallah, Noor, I will see you after your 1 month.
Yes.
And you will be more healthy, بإذن
Inshallah. Thank you very much.
You are welcome.
Mr. Muhammad?
Hello, yes, I'm Mr. Muhammad.
I am Dr. Najat Al-Khawlani. I came to emergency room to see you, who's the general physician, told me that you have a chest pain. Can you tell me more information information about your condition, please. Tell me, how old are you?
I'm 67 years old.
Okay. Are you smoker or alcoholic?
No, I don't smoke.
Okay. Tell me, please, about your complaint. What's happened for you?
I have chest pain. My chest hurts. It's like fire in my chest, and the pain is in my chest and in my jaw. It's really severe and it's really hurting.
Okay. Tell me, for since how long this pain was happened?
Maybe 1 hour. Since 1 hour, it started suddenly, and I have difficulties breathing. I can't breathe well.
Okay. Is it radiating or localized?
Just to my neck, and a little bit to my shoulder, but mainly to my neck and maybe my left shoulder.
Is there any aggravating factor? Anything increasing this pain?
No. It just suddenly happened 1 hour ago. It happened before. I had the same thing before, like 3 years ago, maybe. I had the same thing, chest pain with difficulties breathing and sweating, etc. But I didn't go to the doctor. But I had the same thing maybe 3 years ago.
This is with the same severity or more than before or less? Or
It's the same thing. It really hurts. It's really severe.
okay. Tell me, is there any other symptom associated with this pain, such as sweating, such as
Yes,
dizziness, or
I'm sweating and I have difficulties breathing. I can't. I breathe hardly. I hardly breathe.
vomiting? Okay,
No, I didn't vomit. No.
okay. Is there other symptoms such as shortness of breathing?
Yes. I breathe hardly. I have difficulties breathing. But
Associated.
the pain is, it really hurts.
Okay, okay. Tell me regarding other symptoms such as awareness of your heartbeat, lower limb edema.
No,
Is
no.
Tell me if there is any history of loss of consciousness
Today, no, and even before, I didn't lose conscience before.
or history of convulsion, history of weakness in your right side or left side.
No. I have just chest pain and a little bit of pain in my jaw and in my left shoulder. That's it.
Okay. Okay, regarding your past history, do you have any history of diabetes?
Yes, I have diabetes. I have diabetes since 10 years, and I take like little white pills. I don't have the pills. I don't know the name of the pills.
Pills, not insulin.
No, pills, just pills.
Okay. And your random blood sugar, is it okay? Did you do follow up for your?
I didn't go to the doctor since a long time, to be honest. I don't take my medications regularly.
Okay. Okay. Did you have any history of hypertension before?
Yes. I take medication for hypertension as well, but I don't know the name of the medication, and to be honest, I don't take them regularly as well.
Is it controlled, your blood pressure?
I sometimes take my blood pressure. It's usually around 120.
Okay. Did you have any history of the stroke? Do you know what's the meaning of stroke? Numbness, weakness in your body, either ischemic
No.
or hemorrhagic stroke before?
No.
No. Do you do any procedure for your cardiac catheterization for your
I
heart?
didn't go to a cardiologist before, but I had the same chest pain 3 years ago, as I told you.
Okay. Tell me about your family. Anybody has hypertension or diabetes or stroke or ischemic heart disease in your family?
My mother had hypertension, but she's dead now. She died naturally, natural causes, but nobody has cardiac disease or something.
Okay, your family or you, do you have any history of renal impairment, renal problems?
No, not that I know of.
Okay. Do you have any history of allergy for medications, for your medication,
Not
or
that I know of. No.
contrast, any allergy for contrast?
I didn't have allergies before. I don't know for contrast.
Okay, Mr. Muhammad. See, Mr. Muhammad, now regarding your electrocardiography, which was done in emergency room, and regarding your echocardiography, which was urgently, and regarding your lab investigation, which including your cardiac enzymes, and as I see in the monitor that your blood pressure is going down, you have a hypotension, and regarding your symptoms like chest pain and dyspnea, the diagnosis of your condition, unfortunately, is the new cardiac attack. It's called, yeah, I'm so sorry for that. It's called the non-ST elevation myocardial infarction regarding the classification of the electrocardiography. Did you hear about this disease before?
No, what should we do now?
The good news for you that you came at the golden time at the first 2 to 3 hours. The disease means that you have occlusion or narrowing in your coronary arteries, which supply your heart muscle. There is, as the investigation tell us that you have a narrowing or diminished in the supply of your cardiac muscle. So we should do saving for your muscle, this cardiac muscle.
We will do it now?
Yeah, you should do a procedure. The management is a golden management for you, which is called the percutaneous coronary and intervention. Yeah, and
I heard about it before. Because one doctor asked me when I told him before, a general physician, when I told him about the burning in my chest, he told me that maybe I will need it, and he sent me to the ER.
Now you are in need for this as early as possible, please, to save your heart muscle, to avoid the complication. Are you agree to do this procedure?
Okay. Does it have any complications, or is it something you do usually?
See, this procedure has a risk as any procedure which will be done. But the benefit of this procedure is more important. So you should do this procedure, and we are here to help you, to support you, to do everything can be done. And it is okay for you that you came at the golden time. You received, as the general physician told me, the loading dose for the aspirin and for the antiplatelet was taken. And if you are agree to do this procedure, I will activate now the cath lab to come to transfer you to the CCU, to intensive care unit, then to cath lab to do this procedure as early as possible. And now I will take the consent, verbal consent and written consent for this procedure. If you have any question, you can ask me till the arrival of the members of the cath lab. Okay.
Maybe we'll do it, and later we would discuss. It's really hurting me. Do we need anesthesia for this, or is it gonna be while I'm awake?
No. It can be done under local anesthesia. You can see everything surrounding you, and I will
be awake.
Okay. Let's shift you to the Foot care unit. Okay. Now, this is the third hour post percutaneous coronary intervention. Are you okay now?
I feel better. My chest doesn't hurt anymore. It's really lighter. I don't have any chest pain almost.
Okay, said Mr. Muhammad. The procedure, percutaneous coronary intervention, was done successfully without any complication. And as I see in the monitor, your heart is doing well. Your heart rate is okay. Your blood pressure is very nice. And regarding chest pain, I think it's improved better than before.
Yes. What did you find? What did you do in the procedure?
As I told you, we found there was a critical lesion in your coronary artery, in the artery which is called left anterior descending artery. This is a very important coronary artery that supply about 75% of your heart muscle, and the lesion was in the proximal part. We did the stenting for this. Restoring the reflow of the coronary artery successfully. And also, we found diffuse lesion in another coronary artery, which is called the right coronary artery. But we decided to do the procedure again after 2 weeks, if possible. If your condition didn't improve, if your heart rate is still low, if your blood pressure is still low, and if you still have symptoms, we will do the stenting for that coronary artery. Is it clear?
It's clear, but after that, there will be nothing else to do. I will get my life back and...
No. Regarding you should take the medications. See, you should take some medications for long life, such as aspirin, which was taken before. You should resume it for a long life. You should use the statin anti-lipid medication long life. You should take antiplatelet. I will show you later for at least 1 year. You should resume your antihypertensive medication, and you should control your blood pressure, and you should use anti-diabetes medication regularly, and you should control your random blood sugar and HbA1c strictly to avoid the complication which can be having, such as new attack. We should
and I will have to do this like forever. I'll take the pills forever.
Yes.
Like for a lifelong time.
Yeah, and you should visit us. I will arrange for you the visiting for us to visit the doctor about every month at the first 1 year post this procedure, and about every 3 months after 1 year. Why to visit us? To see your heart rate, to measure your blood pressure, to see the function of your heart, to maximizing the treatment if you are in need, and to do stress exercise if needed, to do electrocardiography, to do echocardiography if needed. And you can resume your life activity as before, gradually after this procedure, starting after 1 week to 2 weeks. And also I advise you to change your lifestyle. If you are smoking, you should stop smoking. Don't sit beside smokers, and restrict your diet of diabetes, decreasing the salt intake, because you are also the hypertensive, decreasing the saturated fat, and increasing vegetables. And you can do exercise, the moderate exercise as tolerated. I advise you to do the walking, swimming, the walking for about half to 1 hour daily. It is better for you, And I asked you regarding the medication, don't forget to use any dose of medication to protect your heart and to prevent another attack. Is it clear for you?
Yes. I'm a little bit afraid. I'm afraid that this will happen again. So do you think that if I take my medications, like the hypertension and the diabetes medication and the medications that you gave me, and I don't smoke, so I wouldn't be smoking, do you think that I could prevent another attack? Or do you think that this will be happening again?
Mostly, if you obey this advice, the another attack will be prevented. Yeah.
Okay. About the last time I had this chest pain when I didn't go to the doctor, do you think it was the same thing that I had now? Do you think it was an attack as well?
Yeah, it could be due to the heart attack, and you didn't ask for medical advice at that time.
No.
It was making another attack happen. You didn't before you was not using medication regularly. You didn't visit doctor regularly, so the attack happened for you. So I advise you to change to come to visit doctor regularly to prevent this complication or symptoms, or if you feel new attack of chest pain, I advise you to come as early as possible.
So now if I take my medications, if I don't smoke, and if like I get everything on track, there will probably everything will be probably okay. There will probably not be any, and that will prevent any other attack.
Yeah, but if you develop any symptoms such as chest pain, symptoms of heart failure such as dyspnea, we will advise you to do the second procedure, percutaneous coronary angiography, stenting for the right coronary artery. It is better.
Okay. It's a lot to process, but it's clear. Okay.
It's clear. Okay. Is there any question?
No, it's quite clear. I just have to get things on track. I just have to focus on it, but it's clear.
Okay. Thank you.
Thank
See you next visit. Okay, after 1 week.
Thank you, doctor.
Bye. Okay, bye.